Q10, also known as coenzyme Q10, is used for heart problems, high blood pressure, Parkinson's disease, gum disease, and certain inherited diseases like Huntington's disease and muscular dystrophy. It's also used to reduce the number of migraine headaches and to reduce cell damage after surgery or treatment with certain anti-cancer drugs. Coenzyme Q10 is a substance that your body normally makes and uses to help keep you in good health. It's important to consult your doctor for advice on proper care and treatment if you have or think you have any of these conditions. Additionally, it's important to check with your pharmacist about the brand you use, as some herbal/diet supplement products may contain harmful impurities or additives. As always, consult your doctor or pharmacist for more details, as the FDA has not reviewed this product for safety or effectiveness. When taking Q10, it's important to follow the recommended daily dosage and consider the optimal timing for taking it. When taking Q10, it is important to follow the directions on the product package. If you have any questions, it's best to consult your doctor or pharmacist. If you are using a liquid or powder form, be sure to measure your dose carefully using a medication measuring device or spoon. Avoid using a household spoon, as it may not provide the correct dose. If your liquid form is a suspension, shake the bottle well before measuring each dose. If your liquid comes in a tube/ampoule, take the dose immediately after opening and discard any leftover liquid. Follow the manufacturer's directions for mixing the powder form. If you are using chewable tablets or wafers, be sure to chew each dose thoroughly before swallowing. If you are using a tablet made to dissolve in the mouth, place each dose on the tongue and allow it to dissolve completely, then swallow it with saliva or water. It's important not to crush or chew extended-release tablets, as this can release all of the drug at once, increasing the risk of side effects. Also, do not split the tablets unless they have a score line and your doctor or pharmacist tells you to do so. Swallow the whole or split tablet without crushing or chewing. And if your condition lasts or gets worse, or if you think you may have a serious medical problem, it's important to seek medical help right away. Side effects of Q10 are generally very rare, but may include nausea, loss of appetite, upset stomach, or diarrhea. If any of these effects persist or worsen, it's important to consult your doctor. Serious allergic reactions to this product are also rare, but if you experience symptoms such as rash, itching or swelling of the face, severe dizziness, or trouble breathing, seek medical help immediately. Remember, this is not a complete list of possible side effects, so if you notice anything unusual, it's best to talk to your doctor or pharmacist. As always, if you have concerns about side effects, reach out to your healthcare provider for advice. Before taking Q10, it's important to talk to your doctor or pharmacist if you have any allergies, diabetes, or heart disease. This product may contain inactive ingredients that could cause allergic reactions or other issues. If you are pregnant or breastfeeding, make sure to discuss with your doctor before using Q10. Additionally, if you have diabetes, alcohol dependence, liver disease, or phenylketonuria, PKU, consult your doctor or pharmacist before using Q10, as it may contain sugar, alcohol, or aspartame. Finally, it's best to discuss the risks and benefits of using Q10 with your doctor, especially if you are pregnant or breastfeeding. As for the optimal timing and dosage of Q10, it's best to follow your doctor's recommendations based on your individual needs and health conditions. It's important to be aware that Q10 may interact with other medications, potentially affecting how they work or increasing your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Never make changes to your medication dosage without consulting your doctor first. Some drugs that may interact with Q10 include those for high blood pressure, blood thinners like warfarin, diabetes medications, and high cholesterol drugs such as atorvastatin and levastatin. Always consult with your healthcare provider before taking Q10 if you are currently taking any of these medications. As for the ideal dosage, it's recommended to take 100 to 200 mg per day, and it's best to take it with a meal to improve absorption. If someone has taken too much Q10 and is experiencing severe symptoms such as loss of consciousness or difficulty breathing, it is important to seek immediate medical attention. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Make sure to keep all your medical and lab appointments to monitor your progress and any potential side effects while taking Q10. This will help your healthcare provider ensure that you are getting the most benefit from this medication. If you forget to take Q10 at your usual time, take it as soon as you remember. However, if it's close to your next scheduled dose, just skip the missed one. Don't take extra to make up for it. Make sure to check the storage information on the package and protect the liquid form from light. If you have any questions about storage, ask your pharmacist. Keep all medications and herbal products away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.